Hi, I'm sorry I can't be with you today. I would have been at the original seminar, but unfortunately I had booked a trip to the States to see family. So I'm doing a Zoom film and PowerPoint to make my points. So I've called this Disability Rights Perspective in Curriculum and Assessment Review. And I've had a background in doing this for more than 30 years, set up Disability Equality in Education, then World of Inclusion, where we looked at both the methods of developing inclusive education in the classroom, but also how to bring disability into the curriculum, which developed more with Disability History Month over the last 15 years and put into practice around the Commonwealth as the General Secretary of the Commonwealth Disabled People's Forum. I'd like to start by talking about the definition of disability in the UK under the Equality Act 2010, which defines disability is a physical or mental impairment that has a substantial and long-term adverse impact on a person's ability to do normal day-to-day things. Substantial here means more than minor or trivial, long-term 12 months or likely to 12 months. In 22-23, there were 16.1 million people, or 24% of the population in the UK, according to the Family Resource Survey, under this definition. It shows 11% 0 to 15-year-olds, 17% of 16 to 24-year-olds, with that doubling in the last 10 years, with the biggest increase in mental health and social behavioural issues, particularly neurodiversity. In England in January 2024, as most of you will know, we have 18.4% of the school pupils from 0 to 16-year-olds with special educational needs and disability, 4.8% with EHCPs, and 13.6% with SEN support. Now, if you take that definition at the top and put it into those statistics, I can think of very few, if any, children presenting with special educational needs, disability support that don't come under that definition, because even to be noticed will take at least 6 months, if not 12 months. So they would come under it. And why they'd be noticed, because they're not doing the average or the normal day-to-day activities that you would expect of people which were age appropriate. So that would put most of those people as disabled and those children. Of course, it's still very much personed on what you can't do, this definition, and we need to look wider for a different definition. And so we come to the UN Convention on the Rights of Persons with Disabilities, which was a reaction to the disability movement pushing very hard for about 20 years for a human rights approach to disability based on the social model approach. So this recognizes in the preamble that disability is an evolving concept, and disability results from the interaction between persons with impairments and attitudinal environment barriers that hinder their full and effective participation in society on equal basis with others. So it's not their impairment that's the problem, it's the interaction with attitudes and environmental barriers. And to put it more specifically, in Article 1, persons with disabilities include those who have long-term physical, mental, intellectual, sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on equal basis with others. To spell this out and the evolution of this thinking on disability, let's go here to looking at how this has evolved. Impairment, that is a loss of function, as defined on the previous slide, has been with us as long as there have been human beings around. Now, the causes of it may vary from doing battle with a hairy mammoth to a traffic accident, but the long-term effects will be that you have a loss of function. The degree varies, but the social reactions are very much similar, although change a bit over time, and that's what causes disablement. For thousands of years, the overwhelming social response was negative, with the occasional veneration, i.e. saints or sinners. This led to the traditional and charity models. Then with the Enlightenment, we saw a burgeoning of medical science suggested a limited solution of fixing some impairments, seeing the person through the medical lens, what they can't do really. And that became the way that most disabled people were seen, and then migrated into special needs. And it was all the resources were based on what you can't do. So we still resource people according to how much they can't do on a normal scale, rather than schools to empower them to do what they can do. Along the way, false science intervened with eugenics and social Darwinism that led to segregation and isolation of disabled people, particularly in schools, with the first learning difficulty schools and colonies being set up to keep these people who were a danger to the gene pool away from everybody else. Now, you may laugh at that, and it's ultimate, which led to the deaths of disabled people in Nazi Germany, because they were seen as useless eaters. But then you also need to think of the statisticians like Pearson and Cecile Burt and others, psychologists who were involved with this, who recognized that we needed to test this fixed amount of ability in people by tests. So we had the 11 plus, and then now we've got SATs, but these are all on one dimension of intelligence, and people are sorted out in that way. We're going to have a curriculum that includes everybody. We're going to have different metrics. Disabled people increasingly resisted and identified reactions to them as socially and culturally derived. They identified disablement as a result of attitudinal, environmental, and organizational barriers they faced as people with impairments. This was the social model and was the big breakthrough in thinking. However, it took quite a long time to get this through in the UN, but by 2006, it was agreed, and we got a social model, human rights model in the UNCRPD, now ratified by 191 countries, including the UK in 2009. But where have we gone with it? Well, if you look at Mr. Goh's changes to the curriculum, which were perhaps the most radical in the last 20 years, increasing it to knowledge-based and testing people's knowledge, cutting the bottom off it and getting rid of alternative routes through accreditation and so on, it's not really surprising that 13.3% of disabled people in the age group 21 to 64 have no qualifications, compared to 4.6% of non-disabled people. And it isn't just there. The grades that people have got and whether they're really useful, there's quite a big difference there, which affects life chances. And it affects life chances, particularly if you look at those with significant neurodiversity and learning difficulties, where only 4.5% of them after this education for 15 or 16 years have employment. So we're getting something wrong considerably on route. We look at what we're required to do on the UNCRPD Article 24 on inclusive education, requires governments to develop inclusive education systems for disabled students with reasonable adjustments and the right support, while teachers are trained to manage inclusive classrooms and alternative communication systems such as sign language, braille, easy read, and pictograms. And general comment number 4, which is the most important document on implementing Article 24, and in fact is legally binding in international jurisprudence, now named the Right to Inclusive Education. A key paragraph says, ensuring the right to inclusive education entails a transformation in culture, policy, and practice in all formal and informal educational environments to accommodate the differing requirements and identities of individual students, together with a commitment to removing the barriers that impede that possibility. It involves strengthening the capacity of the education system to reach out to all learners. It focuses on the full and effective participation, accessibility, attendance, and achievement of all students, especially those who are, for different reasons, excluded. So that's a very clear statement. And what has the UNCRPD committee been saying to the British government? Well, there was an inquiry in 2017, and since they've repeated the same message, that the British government need to get on and do the following: develop a comprehensive and coordinated legislative and policy framework for inclusive education, and a time frame to ensure that mainstream schools foster real inclusion of children with disabilities in school environments, and teachers and all other professionals and persons in contact with children understand the concept of inclusion and are able to enhance inclusive education. Not been happening. Instead, we are arguing still about what is inclusion, although it's pretty clear from the last 2 slides. Strengthen measures to monitor school practices concerning enrolment of children with disabilities and offer appropriate remedies in cases of disability-related discrimination or harassment, including deciding upon compensation. There is still no compensation if you take the disability discrimination route to the tribunal. So that needs to be sorted out to put more pressure on schools to stop discriminating. Adopt and implement a coherent and adequate financial strategy with concrete timelines and measurable goals on increasing and improving inclusive education. So really, we should put a better price tag on a mainstream place than in a separate school place, or at least put them on the same level, which they are not at the moment. The strategy must include ensuring the implementation of laws, decrees, regulations on improving the extent and quality of inclusive education in classrooms, support provision and teacher training, including pedagogical capabilities, which have been going from bad to worse, as far as I can see. Across all levels, providing for high-quality inclusive environments, including within breaks, between lessons, and through socialization. Set up awareness raising for parents and provide sufficient data disaggregated by impairment, age, sex, and ethnic background, and outcomes. We don't collect outcome data for many disabled students at all at the present time. One other thing to put into the mix before I start saying where I think we need to be going, don't forget the general public sector duty, which was came into being in April 2011 of the Equality Act, and this applies to disability and other strands. The single public sector equality duty will require public authorities, including schools, and that is all schools that receive government funding, even if they are non-maintained special schools, they're still receiving a huge amount of government funding, so it applies to all of those, and indeed many private schools where the places are being bought by the public purse. Eliminate this disability discrimination, harassment, and victimization, not tolerate it, eliminate it, and that includes all forms of bullying. Advance equality of opportunity, remove and minimize disadvantage, take steps to meet the needs of groups, protected characteristics, and encourage their participation. Foster good relations, tackle prejudice, and promote understanding. This duty falls on the trustees of academies or on the governors of maintained schools. And they can be judicially reviewed for failing to do it, as can local authorities. So who is doing this? Well, Ofsted won't do it, and local authorities don't want to do it. Perhaps the Equality and Human Rights Commission should have extra powers, like the Health and Safety Executive, to put prohibition notices on schools that fail to comply. So what do we need to do for an inclusive school curriculum? Well, I think just going to pause this for a minute. So we have three factors here: values, the taught curriculum, and reorganization of how we deliver it. First of all, I think the values recognise the curriculum includes everything that happens in and around the school, intentional building of friendships, relationships, developing peer support, person-centred approaches, equipping all and requiring all to challenge disableist name-calling and bullying and understand disableism, empowering and building self-confidence for disabled learners, ensuring disabled learners fully participate in the curriculum and see themselves in it. The values of the school are whole school, inclusive and person-centred, and that the behavioural system is aligned and demonstrates these values. Secondly, the taught curriculum, the knowledge, skills and understanding for learners in child-centred and diversified to accommodate learners with different levels and degrees of attributes and impairments within the curriculum. So we need a pedagogy and organisation of learning in the school developed and organised to meet the above principles. Progress should be measured in terms of personal achievements mainly rather than a normative approach, and content should be engaging. Assessment is mainly formative, and where summative, routes are required in a variety of different paths and are available, and methods should be accommodate full range of expression and cognition. And here we come up against the problem of competency standards, and these need to be very much re-examined and decide that there isn't just one way of measuring people's competencies, that there has to be much more diversity in all of this. The next thing is, of course, reorganization of the school learning environment is organized to remove barriers, promote full access, provide reasonable adjustments with the requisite support as an ongoing process. So it requires regular disability equality training for all school staff delivered by disability equality trainers, recognise a process utilising school-based self-evaluation systems such as the Index for Inclusion with audits of barriers for disabled learners. I was involved with the Index from '96 onwards in developing it. It had a social model at the basis of it and was looking at these policies, practices and culture of the school, and was a very useful self-evaluation tool, and schools engaged not only the students, but also the support staff, parents, support teaching staff and management, gave you different mirrors held up to the school, and people identified what needed to change. And that's a very useful school review mechanism. Ongoing and mandatory training on the pedagogy of inclusion for all staff linked to professional advancement, possibly master's degrees being followed on inclusion, which would then give people enhanced payment. Sharing and developing of moderated practitioner-led teaching, learning and assessment resources for all key stages with additional non-contact time for development and preparation. If we're going to have major school curriculum and pedagogic reorganization and development, there has to be time for people who work together to plan together. And it's not good enough that we have the lowest level of non-contact time in Europe. An example of how some of this worked, now going back nearly 20 years, we were asked by the government's education department to survey and produce a handbook on reasonable adjustments as part of the implementing the Disability Discrimination Act in schools in early years. We started with the NASON list of schools that subscribed to NASON. There were 10,000. We sent out a questionnaire to all 10,000, got 500 replies that met our criteria that they were making reasonable adjustments for 5 groups of disabled students, down to a short list of 90. And then we visited the final group of 41 and filmed and interviewed people. You can still see those films both on those 2 websites below, particularly on the World of Inclusion one. But we also interviewed over 300 people and heads, staff, parents, children, support staff, and specialists from outside the school. And these were the key factors that led to those schools being outstanding, really, in what they were doing in providing inclusive provision to make reasonable adjustments. They had a vision and values based on an inclusive ethos, a can-do attitude from all staff, proactive approach to identifying barriers and finding practical solutions, strong collaborative relationships with pupils and parents, a meaningful voice for pupils, positive approach to challenging behaviour, strong leadership for inclusion from senior management and governors, effective staff training and development, use of expertise from outside the school, building disability into resourcing arrangements, a sensitive approach to meeting impairment-specific needs, regular critical view at the pupil, department and school level. What they lacked was the availability of role models, very few disabled staff, and very little mention of disability in the curriculum. Nevertheless, if I go back, and I have been back to most of these schools since, the effect of government reform, austerity, which has cut back staffing levels on SEN throughout mainstream schools in particular, and the curriculum reforms and the more competitive environment created through Ofsted and academies, I have found that most of those schools no longer have that practice that they had 20 years ago. And it's not surprising, because in 2006, 61% of children with an EHC plan or a statement were in mainstream schools. It's down by 11% on that currently. So we need to see and take count of all of those things. But I want to now talk about bringing disability from a social model, human rights model, into the curriculum. And this came about when I did an evaluation for Ed Balls when he was Secretary of State, the DFE, on how good they were on their disability equality plan. We went to a number of schools and interviewed students. And one of my recommendations was that we needed to bring the social model human rights perspective into disability in the curriculum. And we made a number of films, but this one, I think, is the one I want you to listen to.
Attend 4 schools that are working to embed disability equality into the curriculum.
We should learn about disabled people because you may have a disabled friend or become disabled yourself in the future. I think that the assembly and the lesson were awesome. We learned about the rights of disabled people around the world.
What do you think about disabled children being bullied more than other children?
I think that that's just a bit ludicrous, and that shouldn't happen, because disabled people are still one of us. If we were all not disabled, it wouldn't be right, because everybody's different and everyone's unique in their own way.
Life's not just about maths and English, it's about understanding other people and how they were and how like they were.
I'm dyslexic, and in primary school, people weren't exactly calling me normal, and now, as I come out as a gay man, it's people, every time I say like I'm a normal person, they say you're not normal. That's why I try never to use the word normal, because we're all different, and what our differences make us average human beings.
Should disability equality be included in the curriculum?
I think that would be a really good idea, because it opens it up and it means that people can talk about it, and it's not something people are scared of and don't understand. It's something that is accepted and is known about.
Hopefully it would stop bullying and
It's a good idea, because like we all need to like be able to understand each other, because that's the only way we can improve like our community.
I think an emphasis on sort of psychological disability, bipolar disorder, things like that, that don't get addressed. Mental disability is still something that feels like it's very far off from people's understanding and their sort of consciousness of it actually existing.
I think learning about disability should be in the school curriculum, because it's all about exposure, awareness and understanding. And if you don't have any one of those 3 very important parts, then you're not going to truly understand what it feels like to be disabled, or also how the disabled person feels when you criticise them.
School's meant to be preparing us for life, and all of that is disabilities, mental and physical, are a reality to life that people must know to be able to kind of go on in life.
So what parameters guide the disability equality curriculum? Well, first of all, the recognition that impairment is part of the human condition. and though varies in type and degree over time, dependent on access to knowledge and medical science, know and understand that cultural and social reactions vary through history and geography and have been predominantly negative, and how these issues are dealt with in recent times in society. Understand disabled people are those with impairments who face attitudinal, environment, organizational barriers, that disabled people have human rights, including to be treated equally, eliminate discrimination, exploitation, violence, abuse, be provided with accessibility, a human right that only applies really to disabled people, access inclusive services, including education. So inclusive education also only applies really to disabled people in the sense of making the adjustments that are actually necessary. Live independently in the community once a young adult with a reasonable standard of living, access to employment, including a right to redress in all these areas. And currently, there's very little right of redress for disability discrimination in schools, and more needs to be done about that. Universal design to be progressively developed. That the above should be applied to all curriculum areas from early years right through Key Stage 1 to Key Stage 5 on a spiral basis across each curriculum area, at least in one program of study in each curriculum area, in each subject area, in each key stage. So that's what we'll be looking to do. Now, I have carried out hundreds of activities and curriculum approaches which have been shown to work, and I just want to go through a few of those. So for instance, English literacy, one easy thing that you can do is get the class in groups with a piece of flip chart paper and 2 different colored pens to write, first of all the words they've ever heard that apply to disability, and so you can be as rude as you like. And then with the other color to go around the ones that are good. And usually it's less than 5% that are seen as good words. From that, you can lead to discussions. We can analyze storylines, characters, and stereotypes in traditional literature compared with the literature written by disabled people. We can look at and analyze factual writing, the newspapers, and so on. We can use the language guides that are in the Anti-Bullying Alliance on this link. In the reading corner on every primary year 1 to, or even early years up to year 3, there should be picture books which feature disabled people, and then books higher up should feature disabled characters in a positive way, not a stereotyped way. As we can see, it's not just one stereotype, but there are a whole number. We're evil, we're laughable, we're a victim, we're pitiable, we're a burden, we're incapable of participating, we're just used as an atmosphere, we're asexual and incapable of adult relationships, we're vengeful, and sometimes we can be the super crip, as we've seen in some of the adverts from Channel 4 for the Paralympic Games, which put all the disabled people who can't do those things in a very difficult and awkward position. Because during the Para Games, people think, well, why aren't you doing that the same as everybody else? Well, we're not. Some people like to do that, and that's fine. Another thing you can do is take traditional tales, which Snow White and the Seven Dwarfs, Rapunzel, Rumpelstiltskin, and get groups to rewrite them from a positive point of view. So for instance, Rumpelstiltskin. Once upon a time, there was a little man called Rumpelstiltskin who never grew like everybody else. So he was different. He was a good man and was a good person. Rumpelstiltskin helped the people and gave the people some money. They liked him because he was kind to them. They gave the little man some good food. Rumpelstiltskin spun straw into gold and did not want to take the maid's baby. So they lived happily ever after. Portrayal, we've done a whole lot of work on portrayal, disabling imagery with the BFI, for instance, which you can still access on our website. You can look at and analyze literature, advertising, soaps, dramas, films, TV, radio, and computer games. So there's plenty to look at about how disability is portrayed in language and in imagery. We can do work from a numeracy and mathematical point of view, look at simple statistics like the number per 100 disabled adults who are working for disabled and non-disabled people, simple bar chart, or we can look for upper key stage 2, early key stage 3, looking at codes. How many permutations can you get on the 6 of a dice? Because that's what Louis Braille based his code on, of course, with raised dots. We can look at measuring gradients around the school for ramps. They should be between 1 in 20 and 1 in 12, or in the local environment. We can map them, we can measure, we can do turning circles, we can do light levels, we can do lots of different things which use measuring and applied mathematics. We can analyze graphs, line graphs, bar charts, here the proportion of people who report a disability. And there are many other areas which we don't have time to go through, but art and history, I'll give a few examples. Frida Kahlo is very often now talked about in art lessons in secondary schools, but rarely is her disability and her impairment. She had 3 impairments: polio as a child, then a dreadful accidents where a rod went right through her spine and her pelvis, and then having an amputated leg. So she lived in pain for a lot of her life, but she still had a full life and created amazing art and was a socialist and fought for what she believed in. It's important that the whole of the person is talked about when we look at this. And this young year 11 student doing art decided, because she saw this work of Frida Kahlo, to use her scoliosis and her X-ray for her one of her pieces that she put in for assessment. We can look at history, whether it be Julius Caesar, who was epileptic, who often was absent from the battlefield, or Harriet Tubman, who also had fits because she'd been hit on the head very heavily by a supervisor as a slave before she set up the Underground Railroad. The reality of Shakespeare's play and the images of Richard III as a mass killer, how realistic are they, or were they just Tudor propaganda? Because we know now from the Lester Carperk skeleton that's been identified as his, is that he had strength in his upper body, but he had scoliosis. He didn't have a withered arm or a lame leg, which Shakespeare gave him. Or Gauguin and Vincent van Gogh, for instance, looking at the effect of his mental distress on his art. Or going back to ancient Greece and Hephaestus, who had a club foot and was thrown out of Mount Olympus by the other gods, here shown on this frieze. Or we can look at late medieval Holland, where leprosy was spreading very quickly, came back from the tropics with the spice boats, and segregation was the order of the day. But the good burgomasters and mistresses had to give 10% of their income to the needy poor, but the needy poor had been punished by God, and so they had all their worldly goods taken away in taxes. Or why the Duke Federico Urbino is always painted sideways on, 4 or 5 paintings of him from medieval period. Why? Because he had a big slash right across his face, and it wouldn't have been nice to look at him. So how do we draw all of this together? Well, I could talk much more about this. During this QCAD project, which I talked about, we held a steering group meeting, and there's a much more detailed presentation there you can access. We developed a wide range of resources for use right across the curriculum, and highly recommended that everybody who started doing this work look to understand the social model of disability. Using the above resources, work was carried out in 14 primary schools, 8 secondary schools, and 3 special schools, and you can look at that work there. Some of it was filmed on the other side of this slide. Later, in 2022-23, World of Inclusion carried out work in 16 schools in Wales on bringing the UNCRPD into the curriculum, a law passed by the Welsh Parliament, and that was a pilot and is now being developed. This work should now be revisited as part of the curriculum review. And I haven't got time to show you these films, but these are the links of them. So we had in St. Matthias, we looked at science and literacy. In year 5 and 6, that was year 1. We looked at myths and disability, and Yarm and Mill Lane Primary in Stockton, cross-curriculum issues, which covered a whole range of issues. St. Peter's Primary in Tower Hamlets, we looked at local study and geography, mapping the barriers in the streets around the school, what was good and what was a barrier. Anthony Gell Comprehensive in Derbyshire, whole school awareness week based on using posters that we'd produced, and then science, history and maths, adapting different lessons to that. At Bethnal Green Technology College in Tower Hamlets, year 7 and year 9 science, and then and Year 8 art and design. And we've also got drama at Camden School as well. So pupils from 4 schools gave their views, and you saw that. So where do we go from here? Well, what I would suggest is that we need to really push the government to say it shouldn't just be a cosmetic change to the curriculum, that we really need to change the curriculums because it excludes far too many children. We need alternative routes and alternative forms of assessment. We need to look again at competency standards, which really exclude a very large number of children in school from pursuing things. We need the vocational and creative routes, which are alternative to the academic route. And we also need to make sure that disability is in the curriculum so that disabled young people see themselves in all the diversity that they are, growing up and empowered with peer support so that they can actually lead useful lives. I thank you.